today the government's role in public facilities and the status of nutrition in Telangana and Andhra Pradesh. And finally, we looked at how these healthcare facilities are operated under a special department called Ministry of Health and Family Welfare. So, up to now, we have seen healthcare facilities are provided by the government and private. Now, the government is providing healthcare facilities are called public healthcare facilities. So, what is the role of the government in public healthcare facilities? Why should government provide these services? Right? Someone have to provide healthcare facilities to the people. Then who is that someone here? Right? So healthcare facilities may be provided by government. It is provided by the government and private, which is one public facility. There are many public facilities in which there is no any profit. Then who will come forward to provide such public facilities in which there is no profit? Right? For example, conducting a campaign against malaria. Okay, that what we call anti-malaria campaign. We call it anti-malaria campaign. Or removing garbage from the severages. So if a campaign on malaria, that is anti-malaria campaign, is given, what will be the profit for a company? Right? So many of the private people may not come forward in such a facility. Running an anti-malaria campaign is a public facility, because to see the health of the public, the health of the public should be safe one. So for that, it is very essential to give awareness on malaria. But what comes to the government, if some money is expensed on it, nothing will come. So do you think that private companies come forward in running anti-malaria campaign? No, because there is no profit in it. So private companies will not show interest in it. In other public facilities where there is what to call a chance to earn profit, there they come forward. Understand? For example, we have seen many of the private hospitals in large cities. Private companies have established many hospitals in large cities in our city we find a number of hospitals run by private companies. This is also one public facility, but it is not offered at a free of cost. Who are providing these public facilities? This public health care, what you call this health facilities, private companies. So they charge. Understand? They charge for every facility and every services given in the hospital, right? Because there they earn money. Understand? So in public facilities, here we have seen two examples. One is running a campaign on anti-malaria, in which money has to be invested, but there is no return on the investment. So such a public facility is not provided by the private companies. In another example, we have seen it may be the hospitals running under private companies, right? What will come there? They will earn money from their investment. So they show interest in such public facility instead. If you look at in your surroundings, some of the private companies supplying drinking water in sealed bottles, water cans. So private companies provide such a water facility in sealed bottles and they charge certain price, right? So those who can pay money to such a bottled water, they buy it. But many of the people cannot pay money for such bottled water, right? They drink water from their own well, which is in a home or by the tap instead. In some rich families, we see every day they get, they buy what you call bottled water instead. So, how many people are buying bottled water in our society? Very few people. Lakhs of people are not able to buy bottled water, which is safe for drinking, right? So, we see here many of the people are deprived of getting safe drinking water, that is bottled water. Understand? That means opportunities to lead a decent life is not given to all. But Constitution promises that equal opportunities for all, that means for all the people, to lead a quality life, that what you call decent life. Under Constitution, there is a fundamental right, that right to life. What is meant by right to life? It is everything is given to the people to lead a quality life. In Constitution, we find fundamental rights. In that one is right to life. So your Constitution guaranteed right to life for all people, right? It means that whatever the basic things are needed to lead a life, that should be provided to the people, right? That means public facilities are very essential for the people to meet their basic needs. What are basic needs? food, cloth, shelter, education, and good health. These are the basic needs. Okay, people health should be good. They should be healthy. So what is required for their good health? That should be provided by the government, because government is working under the constitution have created a body of administration to give better services. So public facilities are needed to the people to fulfill their basic needs. In any society, we find public facilities are to be provided, because those public facilities will help the people to meet their basic needs. Understand? So, who has to provide public facilities? Is it by private or government? Private may not come forward. If they come forward, they want some profit. Understand? So here, public facilities are to be provided to the people at affordable price. We see that many people are, when they hospitalized, they sell their property. Understand? Health expenses are very high. Understand? So certain people are caught up into the debt by the medical expenses, right? If a health problem comes in a family, then such a family has to go for borrowing money to meet that medical facilities or health facilities, and for that they borrow money and they cannot repay it, so they fall in a debt, అప్పులో కూరుకుపోవడం, and they cannot repay it. Understand? So medical expenses are high, health expenses are high. Who can meet this health expenditure? Those who are rich. What about the common people, poor people? How do they get these health expenses? How do they meet their medical health expenses? Right? Where the constitution guaranteed right to life for all. What in by right to life? Right to life, all the opportunities have to be provided for all people equally to lead a better life. So do you think that here all the people are going to get the good health by the health expenses? No. So there is need the government to provide public facilities. Understand? Both there is responsibility on central and the state government providing the health facilities. Understand? In the next page, we see that how health care facilities are provided by the central government institutions. Understand? Let us find out that how is the nutrition status in Telangana and Andhra Pradesh. Right? See, what is needed for people to have a healthy environment. Right? Here, the people need adequate food, safe drinking water, proper sanitization, and preventive measures are to be taken from time to time to get a healthy environment. Understand? So these are very essential. Adequate food in the sense not the quantity of food. Understand? Adequate food in the sense the food in which nutritions are there. Okay, and our surroundings must be clean. There should be proper sanitization, right? During the what you call the season of uh, what you call malaria, dengue, at that time some measurements have to be taken by the government. Understand? So healthcare, it's not mean only treating the diseases. Don't think that the public are getting health facilities in hospital is the only health care. Health care also involves what you call providing the basic needs in a proper way. Understand? Provision of basic needs also part of the health care. That is, what in by provision of basic needs? Food. Understand? Safe drinking water. Then the severages should be sanitized. They should be closed. Proper sanitization. Also part of the water health care. Understand? So are we able to get all these, right? So are we in the sense what we all are the people are getting these in a right manner? Uh, Let us examine the situation by taking the report conducted by a survey. Understand? Here, the recent studies indicate that the level of nutrition of the people in the country is very low. Nutrition levels are very low in our people. Understand? Large section of the people living their life, they did not notice that they are undernourished. Understand? And why they are undernourished? What do you mean by undernourished? They are not getting nutritious food. Nutrition food is very essential to get what to call energy to fight the what health related problem, that is immunity power, right? So though we have enough stock of food grains, we have enough stock of food grains, then also we are getting undernourished problem. It means that most of the people do not have the capacity to buy enough food for their family. This is a what a serious situation that is studied by the what you call a survey. Understand? See, all of us we need some fat in our body, right? The what you call energy will come from the fat. Understand? So here, what you call for to make our day-to-day activities, we need energy. Understand? So our body requires some fat. Understand? So and this will help to fight from the infections. So people who are undernourished, what do you mean undernourished? Who are not getting adequate food, they are what to call prone to get health problems. Understand? People who are undernourished, okay, they suffer with health problems. Understand? So fat requirement from their food for a normal activity is required. So we see that those who are undernourished, they may not be ill, but we see that often they feel weak, tired, and likely to fall ill easily. They may fall ill easily. Understand? So this is a situation we see in undernourished people. So this should be overcome by adequate food. Understand? Not by the medical facilities, not by any medicine. Okay, nutritious food has to be supplied. Understand? This it is what you call a situation of invisible starvation. We see in many families, everybody is getting food. So we may think that they are getting food, but do they get food sufficient one? No. So that as they take food which is not a nutritious one, they fall into the undernourished one, and that is not visible. So we call it invisible starvation. What we call invisible starvation. So here it is they do get food less than what is required. Okay, we'll come to know this with the body mass index. By body mass index, we'll measure the height, weight of the water people. Understand? So here one report is there, that is AP Human Development Report, which is uh, relating to the Telangana and Andhra Pradesh. Understand? And this report says that the status of the nutrition levels in Telangana and Andhra Pradesh. Freedom from hunger. Everybody should get sufficient food. Nobody should be hunger, and they should not be malnutritious. So free from hunger and malnutrition is the basic what to call a human right. Everybody have the right to get food to avoid hungry, not hungry, hungry, and to avoid malnutrition. That is the basic right of the every human being, and it is a fundamental requirement for human development and also what to call the nation development and strength. So better nutrition means stronger immunity system and less illness and better health. So those who get better nutrition, they get a strong immunity and they work for the what nation development. Your World Health Organization have stated that the pure nutrition in India is contributing to the deaths in what to call children below 5 years instead. In two deaths, one is by the what to call infectious diseases, by the nutrition level. If we see that the children who are below 5 years who are dying, in that one child is dying due to the poor nutrition in Telangana and Andhra Pradesh. Such a death of the children by the what you call poor nutrition is 33%. Understand? And those are children what you call below 5 years of age. Understand? Many of the children are underweight. Understand? About 30 percentage of the women and 25 percentage of men are undernourished. What is by underweight? They look that a normal person, but when we measure their weight will not be according to their age. That is called underweight. Understand? So what is the reason for underweight? They did not get nutrition food, nutritious food. That means they are malnourished. Understand? Right? Undernourished. They are not given proper nutrition, so they remain undernourished for long period. Understand? We see that everybody is taking food, but does the food contains nutrition? No. So nutritious food is very essential for keeping healthy environment, for what you call for to have a good health. Understand? This is very essential. Understand? So here it is a thing the government has to provide the basic facilities. So in our India, these health facilities are operated by the Ministry of Health and Family Welfare. It is a department. Ministry of Health and Family Welfare. Under this, we find four departments. How many? Four departments. Understand? One is Department of Health and Family Welfare. This department take cares to control the diseases in hospitals, dispensaries where medical medicines are produced, and in the medical colleges. There, the diseases are controlled at a national level. Programs are run to control the diseases by the Department of Health. Another department, that is Department of Ayush. It works in the local system and provides what you call medicines. Understand? It related to the Ayurvedic, homeopathy, Unani, then Siddha, and also this department do research in it. Understand? Third is Department of Health Research, and this department conducts research in the health activities and medical facilities. Another special department is there for AIDS, that is Department of AIDS Control. This department takes certain programs for preventing the AIDS and giving awareness on AIDS and controlling the what AIDS, which comes by the HIV instant. So it is what you call, we see that this is a complete uh, diagram showing how the health facilities are provided by the Ministry of Health and Family Welfare.